Hello everybody, Cherry back here with Freya. We're talking about pelvic floor, but I'm not going to recap your pelvic floor exercises. What I want you to have a look at is a little bit of an exercise called a hip hinge or a squat, because I want you, for your health of your pelvic floor, to be bending and lifting correctly. However, if you have got a prolapse and you do the squat technique that Freya's going to do, if it causes you any sensation that it's pushing down into the prolapse, then I do not want you to do it. Men and ladies, squatting within reason is good for most people. And it's also very good if you want a bottom like that. Are you sold? Okay, let's be professional now. I'm going to get Freya to put her hands across her chest so you can see what she's doing. The first movement we're going to do is a hip hinge. So you can bend your knees a little bit if you want to. I'm going to get Freya to keep her legs straight, and I'm going to get you to imagine I'm doing this with you. I'm pulling your bottom to me, pulling the bottom back and then coming back up. So I'm going to do it again as if I'm pulling the bottom back. Look at what Freya's spine's doing, head's in line with the spine, and come back up. Okay, so just watch a couple more. Bottom sitting back, this is a hip hinge, and come back up. So I'm going to address this to the ladies. But ladies, if you're going to the gym or you're going to classes and you find that squatting is putting pressure into your pelvic floor, maybe you could we call this a hip hinge or like a deadlift exercise. Watch Freya do it now with a knee slightly bent. Knee slightly bent, bum sits back. You keep this little hip to rib connection and you come back up. And again for me, Freya. So it's a little breath in as you come down and a little breath out as you come up. Okay, so if squats cause you issues, and this is okay, this is still a good way of strengthening your core, back extensor muscles, and strengthening your bottom. Okay, Freya, I'm going to take you into a squat, so you could take the legs just a tiny bit wider. Remember, you don't do this if it causes you any pressure into the pelvic floor. So Freya's going to let her bottom sit back as she did. She's going to bend the knees a little bit more and come back up. Oh, did you hear that knee crack then? Do it again. Now, I know when Freya's doing this, she has to work really hard on keeping that hip to rib connection. It's a bit of a family thing that we've got. We have a bit too much of a curve in our lower back. So you do a little squat and you come back up. Keep going for me, Freya. So I want you to watch it before you do it. Your knees are tracking in line with your second toe. And folks, when you're doing this, look down, and if your knees feel like they're coming together, then put a bit of weight, just a tiny bit of weight, into the outside of the feet. But I only want you to do that if your knees are coming together. You're trying to keep the whole of the foot on the floor. You've not got more weight into your heels. You're not gripping with your toes. Just a little breath in as you come down and a little breath out as you come up. Now, as Freya continues to do that, I want you to use a good squatting technique in your everyday life for picking stuff up rather than bending and picking stuff up. And if you're in classes and you go to the gym, good squatting technique. If it causes you issues with your pelvic floor, prolapse, then maybe you could do the hip hinge instead. I'll get Freya to do one more. Little breath in, little breath out, and relax. Thank you, Freya. Squatting is a great exercise. If we can strengthen your glutes and your core, improve your lifting technique, that in turn will help your pelvic floor.